Hello everyone, in today's video we are going over tonic-clonic seizures. Thanks for watching. Now let's begin. Let's start with the basics. The term tonic-clonic describes two distinct phases of a generalized seizure, the tonic phase and the clonic phase. Tonic comes from the Greek word tonos, meaning tension. In this phase, the muscles suddenly stiffen. Almost every muscle group contracts at once. The body becomes rigid, and breathing may temporarily stop because the chest muscles are locked in place. Clonic, on the other hand, refers to rhythmic jerking. It's when the muscles rapidly contract and relax over and over. So a tonic-clonic seizure simply means a seizure that includes both stiffening and jerking phases. Here, see this example of a classic tonic-clonic seizure. The patient is lying in bed during an overnight EEG recording. Notice how he opens his eyes. This is the beginning of the seizure, also called the ictal phase. The ictal phase is the period when abnormal electrical activity spreads through the brain, producing visible clinical symptoms. In this case, you can see flailing of the arms and legs, followed by turning of the head and eyes to the left. That turning suggests the seizure likely began in or spread through the right hemisphere of the brain, since motor control crosses sides. Next, he enters the tonic phase. During this phase, every muscle in his body contracts. His arms are extended at first, and then they flex inward with the wrists rotated. This is called decorticate posturing, often reflecting activation of deep motor pathways in the brain. You may also notice facial twitching. That's caused by synchronous discharges in the facial motor cortex, sending bursts of impulses to the facial muscles. He's also making guttural sounds, not because he's aware, but because air is being forced through partially closed vocal cords as the chest muscles tighten. Now the clonic phase begins. The stiff muscles start to alternate between contraction and relaxation. That's why you see rhythmic jerking of the arms, legs, and face. On an EEG, this corresponds to rhythmic spike and wave discharges across both hemispheres, showing that the seizure activity has generalized throughout the brain. Next comes the post-ictal phase. Here, the jerking stops and the patient's muscles relax. You can see his eyes roll upward, his breathing is deep and heavy, and he's still unconscious. This happens because the brain's neurons are temporarily exhausted. They've just fired at an incredibly high rate, and now they're in a state of recovery. The nurses suction his mouth to keep saliva or vomit from blocking his airway, a critical safety step. After a minute or two, he begins to regain awareness, but he's confused, disoriented, and may not remember what just happened. This confusion can last from minutes to hours, depending on the person. On EEG, a tonic-clonic seizure begins with generalized spike and polyspike discharges, often 10 to 20 Hz, during the tonic phase. As the seizure transitions to the clonic phase, the frequency of spikes slows down while their amplitude increases. Finally, there's post-ictal suppression, a flat or low voltage pattern, reflecting that widespread neuronal fatigue. What causes tonic-clonic seizures? Tonic-clonic seizures can arise from generalized epilepsy syndromes where abnormal electrical activity originates diffusely across both hemispheres, or from focal seizures that secondarily generalize, meaning they start in one region and spread throughout the brain. Common causes include idiopathic generalized epilepsy like juvenile myoclonic epilepsy, structural lesions such as cortical dysplasia, stroke, or brain tumor, metabolic causes including hypoglycemia or electrolyte imbalance, traumatic brain injury, genetic syndromes such as Dravet syndrome or Lennox-Gastaut syndrome. In some cases, despite extensive testing, no clear cause is ever identified. That's called cryptogenic or unknown etiology. Can you die from a tonic-clonic seizure? Unfortunately, you can, although it's rare. The biggest risk is a condition called SUDEP, or sudden unexpected death in epilepsy. It's thought to occur due to a combination of cardiac arrhythmia, respiratory suppression, and brainstem dysfunction immediately after a seizure. People with uncontrolled tonic-clonic seizures, especially nocturnal ones, are at the highest risk. That's why consistent treatment, regular follow-up, and safety measures are so critical. Safety precautions for patients. If you have a history of tonic-clonic seizures, take your medication exactly as prescribed. Skipping doses is the #1 cause of breakthrough seizures. Avoid triggers like sleep deprivation, alcohol, and flashing lights. If you're photosensitive, don't swim or bathe alone, and be cautious around heights or open flames. Inform your family, coworkers, and friends what to do if you have a seizure. Stay with you, roll you on your side, and never put anything in your mouth. Guidance for caregivers. For caregivers, parents, spouses, or friends, stay calm. Protect the person's head, loosen tight clothing, and clear the area of hard objects. Time the seizure. If it lasts more than 5 minutes, call emergency services. This could be status epilepticus, a life-threatening emergency. After the seizure ends, place the person on their side to prevent aspiration. Reassure them when they regain consciousness. Confusion and fatigue are normal afterward. Treatment options. Medications that are often used to control tonic-clonic seizures include Depakote, effective for generalized seizures and often first line. Keppra, widely used due to its safety and low interaction profile. Lamictal, useful in women of childbearing age because it's safer in pregnancy. Topamax and Zonisamide may also help if there are multiple seizure types. The goal is to stabilize neuronal firing and prevent the excessive synchronization that leads to seizures. In drug-resistant cases, options include vagus nerve stimulation, ketogenic diet, or epilepsy surgery, depending on the underlying cause. Closing thoughts to remember. Tonic-clonic seizures can look frightening, and they are one of the most visible forms of epilepsy, but with proper treatment and education, most people with epilepsy can live full, safe, and independent lives. The key is recognition, preparedness, and consistency in care. And that's it, folks. Thanks for watching, and I'll see you in next Tuesday's episode.